My name is Jerry Walis. I'm the Senior Director of GXP Quality Systems at Cullinan Therapeutics.
I'm Tony Sreih. I'm a rheumatologist by training. I am a VP of Clinical Development at Cullinan. Can you share with us your journey, how you came to find out that you have an autoimmune disease, and what are some of the challenges that you faced initially?
I had just graduated college and I started to notice some significant swelling and pain in the extremities of my hands and joints. So I started to see my general practitioner and nobody could really pinpoint the source. And the pain was getting worse and worse. I had physicians tell me everything from, I'm psychotic, is the best way to say. It's in my head, and came down to an indication of mixed connective tissue disease, scleroderma, lupus, and Sjogrens disease. It wasn't until I, met with a rheumatologist who was very active in research and development and was willing to work with me on a treatment regimen that I finally felt some sort of relief. So a good 4 to 5 years of my life early on was pretty miserable.
I think your story replicates so many stories, so many similar stories in patients with autoimmune diseases. It takes time to establish the diagnosis. So how, being a young man at early 20s, how did that experience shape your life and your future?
I was a very active individual, hopes and aspirations of being a research field biologist. And, right away I was kind of brought to the recognition that that wasn't going to happen. Just to give you some kind of insight, I couldn't move. It was significantly painful to walk. One of my lowest points was, having my mom have to button my dress shirts in the morning because my hands wouldn't move.
How do you manage your day by day? How do you manage your work and juggle your autoimmune disease?
Everyone needs a crutch. My wife was that crutch. I couldn't fathom why a beautiful 25-year-old girl would stay with somebody who, was at that point terminally ill. And she stayed with me every day of that. So I am indefinitely grateful, and she continues to keep me on my toes and making sure that I'm getting the care that I need. I think I have about 8 to 10 specialists that I see routinely. I currently take about, on any given day, between 8 and 10 medications. And I've been lucky to work with a lot of organizations who were able to work with me around those doctor's appointments. Throughout my entire career, I've never missed a day of work for it. And people kind of say, well, why are you so fixated on working? And working's my relief. It takes me to a place where I'm not thinking about the pain and the disease, and allows me to focus on something that I think will ultimately have a larger impact.
So how did you come to work at Cullinan?
Had actually been tracking Cullinan on this particular novel molecule, and saw that there was an opening for a quality position, and figured this is a one-in-a-lifetime opportunity to get to work on something that would have such an impact on my life. So I'll bring kind of a story into this. I never wanted to have a child. And if somebody were to really have asked me why I didn't want to have a child, it was because I was scared. And when I was talking to the physicians about the possibility of this being carried over to an offspring, the answer was, we don't know. I currently have a beautiful 1-year-old baby girl, and one of the reasons I finally kind of conceded and was willing to have a child was seeing the advancement of the therapies that are happening, such as Cullinan, that gave hope, right? Gave hope that if it did carry on, they wouldn't have to go through that hardship. It would be, hey, you're diagnosed, we have a treatment regimen, and you're gonna have a normal life.